Well, whether you like it or not, clocks go back this weekend, bringing shorter days and less sunlight. As I know, the sentiment is real. SSM Health Family Medicine physician Dr. Roopa Shah is with us today to talk about some of the side effects of the darkness, seasonal affective disorder.
Yeah.
It's here.
It's here.
Okay, so tell us what it is. How does it affect us?
Yeah. So, basically as the days get shorter, right, we get less sunlight, which we don't get that circadian kind of, rhythm kind of kicking in as well as we're used to with all the bright sunlight. So we can start feeling down, depressed, more fatigue. Generally people feel sleepier, and then we get irritability, increased anxiety, sleep disturbances, just all of these different symptoms that can kind of happen with that. Primarily can affect young people and women, especially if you've got a history of other mental health disorders like major depressive disorder, bipolar illness, or if you have a family history of mental health issues, you're going to be more susceptible to seasonal affective disorder.
I was going to say, there are groups that are more, prone to this affecting. Why is that?
If you've already got a history of being susceptible to having some depression and anxiety, it's going to be exacerbated at this time of year when we have less sunlight to stimulate kind of that pineal gland and get our circadian rhythms, keeping them on track. And it's just cloudier. We're just getting less sunlight, and we just need that to really thrive. So we're just going to be more susceptible to that.
But the good news is, there's treatment.
There is some treatment.
Let's talk about it.
Yeah. So you have
Okay,
one of
I went to my desk and I grabbed this off of it. You plug it into a USB port. It's a SAD lamp, right?
Yes, this is a SAD lamp, and these are actually quite effective. So you've got the correct settings on here. It does go up. You need the 10,000 lux setting.
Which is something I didn't know. So there are different levels.
Yes.
If you can find one, 10,000
You want to
lux.
have at least that much. You do need to have it set up, kind of like you had it set up,
Yep.
where you're getting it directly into your eyes for a good 20 to 30 minutes first thing in the morning. That's really going to set that circadian rhythm for the day and help kind of get you going and prevent some of the seasonal affective disorder.
Now, if you're not into a light like this, let's talk about maybe a supplement. Could that help?
Sure. The one supplement that I really tell folks to focus on in the winter is their vitamin D.
We need it here in Wisconsin, don't we?
So if you're not already taking one, talk to your physician, but usually you want at least 2,000 international units a day. Some people need a lot higher depending on what your levels are when you begin the winter season. So if you're really low, you may need a higher dose to boost you up and then to maintain your levels. So vitamin D is really key. And of course, that's a supplement, but we also have treatment for seasonal affective disorder. So we have some of the SSRI medications that can really help with anxiety and depression, also cognitive behavioral therapy. So there's a lot of different options for people besides the lamp too.
And we have to say it too, if you do have questions, you want to talk to your doc, right? They're the first people to go to. They know exactly what's going on with this stuff.
Absolutely, because there's varying degrees of it, just like anything else. It's a spectrum where you can have mild symptoms, and then you can have major symptoms that need a little bit more help.
It's a real thing, whether you think it or not.